I think physio is important and can really help with pain management.
A series that gets to the heart of health matters. Narrated by our medical, surgical and clinical specialists.
We kind of get hands-on, a bit of manual therapy to help get the joint moving a bit better, soft tissue massage to help the muscles, and also that can help reduce the swelling as well. And swelling is a really big contributor to pain.
Pain management after a joint replacement is critical to your early recovery. And there's been a number of innovations that are really world leading in terms of how we use, for instance, local anaesthetic pain pumps after a joint replacement to ease the burden of morphine or opiate medication after your joint replacement with the acute pain service.
So my length of stay after a knee replacement is about 3 days. Pain is markedly improved by the 6 to 8 week mark.
The misconceptions around knee replacement surgery is how long it takes to get better. Now some people, and I stress people are individual. Someone takes 6 weeks and they're out playing golf and they're out driving. Other people are in a hydrotherapy pool struggling to get that range of motion by 3 months. You must remember that we're all individual and people progress and rehab at different rates.
It's really easy to overdo it after orthopaedic surgery, and so you need to know when your body's telling you to stop. It's not a no pain, no gain situation. You have to react accordingly. So if you're really pushing through pain, you're going to really struggle with your rehab period, and it's going to make it difficult and probably longer.